Hello everyone, my name is Ivy Liu. I'm the registered dietitian at the Toronto Western Hospital Bariatric Surgery program. In this module of the 1 month post-surgery class, we'll be discussing advancing the diet. When advancing the diet, we encourage you to keep in mind your portion sizes. Remember that the total volume of food that you should be eating in one sitting is around 1 cup. This can vary based on food density. Some food have more air or water in them. The 1 cup is referring to a cup of blended food volume. As you are advancing your diet, we want to keep in mind that everyone's experience is different. There's no rush to get to a 1 cup portion. Some of you may be able to tolerate closer to 1 cup, whereas others may be on the lower end, near quarter cup. This is okay. Neither of these are indicators of how well you will do after surgery or how much weight you will lose. It's most important that you listen to what your stomach is telling you. If you feel pain or discomfort, this means that you have had enough and should stop eating. If you consistently find yourself getting full after only a few bites, pay closer attention to the eating techniques we discussed earlier and make sure you're following that closely, as those can also play a role in how much food volume you can tolerate. So at this stage, we want half of your plate to consist of high protein foods, a quarter to be vegetable and fruit, and the other quarter to be your grains and starches. We also recommend eating your protein foods first. This is because sometimes we may sit down with the intentions of eating a whole plate, but after a few bites, we may feel full and our stomach tells us that's not going to happen. So in that situation, we want to be at least getting your protein foods in, since that is the nutrient that takes priority at this stage. I will say, however, that if the protein foods are sitting particularly heavy or causing discomfort, then taking combined bites of your protein with your vegetables can be helpful. This is because fruits and vegetables have a higher acidity and water content, which can help break down the protein and will also make your bites of the meal a little more tender and just generally easier to chew into a puree texture before swallowing. We often get asked, how many calories should I aim for in a day after the surgery? There is no specific caloric or carb or fat goals after surgery that is backed with research. Instead, if you would like to track numbers, we recommend making sure you're meeting your protein goal of 60 to 80 grams a day, distributed throughout the day in your meals and snacks. Making sure you're meeting your fluid goal of 1.5 to 2 liters a day. Make sure that you're eating regularly with 3 balanced meals and 1 to 3 high protein, high fiber snacks a day, and that you're not often going for more than 4 hours without eating. So we are not going to be spending too much time on these slides going over which foods that you can have on the soft diet. I do want to emphasize that everything we eat has to be tender and cooked in a way so that it maintains its moisture content. That's why we say that crock pots, Instapot, slow cooking, braising, stewing are very helpful cooking techniques in order to make foods easier for your stomach to digest. The other thing with meats that I think is sometimes overlooked is marinating. When you marinate your meats in an acidic-based marinade, for example, vinaigrette salad dressing or tomato or citrus-based marinades, the acid will help break down the fiber within the meat and make it easier for your stomach to digest. Another helpful marinade that folks try is yogurt, which tends to help in adding a bit more protein to the dish as well. Some other high protein foods that may not come to mind and are easy to digest are deli meats. While these are often high in sodium and heavily processed, at this stage they may be helpful because they're easily tolerated and can help us transition toward more solid protein foods. Please do try to use low sodium options if possible. Eggs. They either work for you or they don't. The technique of how you cook your eggs is very important. You can generally start to have poached egg on the puree diet. Some people find that they can handle scrambled eggs or omelets on the soft food diet without much trouble. Other people may have to continue to have them poached for quite some time. The big takeaway here is to listen to your stomach and go with what works for you. In terms of fruits and vegetables, I know that people can be really dying to have a salad at this point. They want that refreshing crunch of raw vegetables. Rest assured that you will get to that point where you can tolerate those things. You just need to take it slowly. So my advice is to see which vegetables you can tolerate cooked first. So let's take carrots as an example. If you can tolerate cooked carrots, then next time try them in a stir fry or lightly steamed, so there's still some crunch to them. Once that goes well for you, then you can try raw carrots. This is something that is absolutely different for everyone. 6 weeks post-surgery, some people can start to tolerate more raw vegetables. Other people may need to wait another month or two before these foods go down well. Try to avoid comparing your progress to others. With this in mind, it is really important to introduce these foods one at a time rather than jumping in and having a big bowl of salad. If the salad doesn't sit well, you won't really know which of those things your body cannot digest. Versus trying things one at a time will give you a better indication of that. With regards to fruit is usually well tolerated by our patients. Again, however, ease into it. Start with soft fruits that don't have a tough skin or seeds, things like mango or banana, peeled apple or peeled peach. Try those things first. Some berries with small seeds like strawberries and blueberries are often tolerated quite well, whereas others like blackberries or raspberries may be a little more difficult because of their slightly bigger seeds. That said, for the most part, fruits are tolerated quite well for people, so you don't need to be too worried about those. Of course, we don't want you eating a ton of fruit or grazing on fruit throughout the day, but fruit can certainly be a good, healthy way to get some fiber in and to get that nice, refreshing sweet taste. As such, it can certainly find a home among your snacks. Lastly, I would like to mention grains and starches. Some of you may not even be at the point where you have enough room for grains and starches, but we do want you to try. The reason for that is that we don't want this to be a diet of just protein and vegetables. We are looking for a balanced meal that includes starch because evidence tells us that this is the most sustainable for people. It allows us to have a wider variety of foods, which means that your diet is more palatable and more enjoyable. We have to be able to enjoy our food in the long run. Having that balance and knowing that you can have a small portion of rice or eventually a slice of toast, these things can be very enjoyable and again can provide us with many vitamins, minerals, and fiber. Some ways to ease yourself into that are by having things like sweet potato or regular potatoes. Baked potatoes are often tolerated well by patients. Include cereals in your diet, like the ones I mentioned already that have higher fiber and lower sugar, such as cashew, fiber one, bran-based cereals. You can try whole grain crackers, and you can continue to have your malto as well. Starting on the soft diet, you're allowed to try well-toasted bread, although we suggest starting with unleavened bread, things like well-toasted pita and tortillas. See how those go for you. Then try well-toasted, thinly sliced bread. The Weight Watchers bread is quite popular with our patients for that reason. Food intolerances are very common among patients. This is where some foods might just not work for you. It's important to keep in mind that these can also change from day to day. Yesterday, this food may have worked for you, but today you just cannot handle it. This is normal, and it doesn't mean that you can never have this food again. What it means is that your body needs some time to learn to digest that food. It can also mean that because things went so well yesterday, maybe you ate the food a little too quickly today, or didn't chew enough, or took larger bites. It could simply mean that we pushed ourselves a little too far and just need to take things a little more slowly and pay more attention to the eating techniques. So once again, just do your best to tune into your process of eating and try to pay attention to those eating techniques as you go along. Tough, dry meats generally don't work well for our patients, and this can be a long-term challenge for many. Even 1 to 2 years post-surgery, folks can still struggle with these tough, dry meats. Food that is reheated again and again, especially in the microwave, tends to dry out, so be careful of that. I find that with bread, rice, and pasta, most people can eventually digest small portions of those things again, although for some, there may be one of these food items that you struggle to tolerate in the long term, and that's okay. As long as this list of food intolerances doesn't get too long, that's what we're looking for. After the first year or so, we will ideally like that list to be no more than 5 or 6 things that you have to avoid altogether. Eggs, as I mentioned, are either your best friend or worst enemy. Some people can digest them fine, while others have more challenges. Remember not to be discouraged if a certain food doesn't sit well with you. You can wait for a few weeks and try it again. For the next steps, as part of the 1 month class package, you have received a lab requisition. Please have blood work completed 3 weeks before your next appointment so that we can make sure to avoid any vitamin mineral deficiencies. One quick note here is that fasting is not required for your blood work. Along with this, before your next dietitian appointment, please make sure to have your vitamin and mineral supplements with you so that your dietitian can make sure that you are getting what you need. At a minimum, your dietitian will need to know what the product is, what dose you're taking, how often. We understand that the supplement protocol can get confusing. So it's really important that we know what you are taking. So if we see a vitamin or mineral deficiency in your blood work, we can then look at your supplements and make the necessary adjustments from there. Now that most of us have reached 1 month post-op, it's important that we look ahead. From here, clinic will follow up with you at 3 months, 6 months, then 1 year post-surgery. At that point, the goal is to transition your care to your family doctor. We will send them a package of information that tells them what blood work is required and what things they need to monitor in the long term, but we will always be accessible to you. Even if your follow-ups are under your family doctor, we're still just a phone call or email away when I'm happy to consult with your doctor if needed. Finally, this is the contact information for our dietitian team for your reference, and I'll see you in the next module.